Let's now start off this bulletin by bringing you some updates from the United States. The US has reported its highest ever daily death toll due to coronavirus, while the global infection has surpassed 1 million. In the last 24 hours, 1,169 people have succumbed to this deadly virus, and around 32,000 people tested positive for the disease in the United States. The virus has infected more than 277,000 and has killed over 7,000 people in America till now. As the pandemic continues to spread rapidly, experts in the US believe that the worst is yet to come, with projections going as far as 200,000 deaths and with an average of 2,000 deaths per day. The Trump administration is expecting the virus to peak and plateau by April the 15th. New York, the epicenter of coronavirus in the United States, is yet to brace itself for the worst of the pandemic. The city's coronavirus victims make a quarter of the entire country's pandemic-related death toll. As of today, more than 3,000 people have died because of the infection, and more patients are likely to overwhelm the city's hospitals in the coming days. The virus spread is yet to reach its peak, but New York is already crippled by the shortage in protective gear and is faced with a lack of medical facilities. Even morgues and crematoriums are being crowded with burning bodies. Increasing number of coronavirus cases has also forced the state to run a tally of all cremations and burials in order to keep track of the death toll.
9/11 was bad. It really was bad, but it wasn't like this. And even with the AIDS epidemic in the 80s, a lot of the funeral directors that were around back then and have dealt with value that's even comparable to what we're getting now, a lot of them are retired or no longer in the industry, and it's really a struggle for all of us that are in the industry. Every funeral director we're talking to, they all have expressed how crazy it is.
Doctors, medical practitioners and nurses are faced with the most difficult situations on the front lines. Hospitals across New York City are being overcrowded by more patients with each passing day. In their long 14 to 16-hour shifts, doctors are also struggling to find protective gear and enough ventilators to treat the patients. Experts believe that the US will fall short of at least 75,000 ventilators during this crisis. In an attempt to solve the issue of shortage of face masks, US President Donald Trump has once again invoked the Defense Production Act. He also signed an order directing his administration to stop exporting N95 protective masks to other countries. Earlier, he had also ordered GE, that is General Motors, to manufacture ventilators until the Defense Production Act. The Trump administration is also recommending US citizens to voluntarily wear face masks to contain the virus spread. But in an ironic situation, the president himself refused to wear one as he felt there was no need for it. However, he repeatedly stressed about mandatory social distancing. Listen in.
I'm also signing a directive invoking the Defense Production Act to prohibit export of scarce health and medical supplies by unscrupulous actors and profiteers. The Secretary of Homeland Security will work with FEMA to prevent the export of N95 respirators, surgical masks, gloves, and other personal protective equipment. We need these items immediately for domestic use. We have to have them.
The coronavirus pandemic continues to be a huge problem for the United States. It has all countries, even China, where the virus was first detected. With the most number of positive cases, the lockdown continues to keep business closed and restricts people from any movement. The pandemic has also severely affected the job growth rate and has also amped up fears of an economic slowdown.
And this is not a first. Whistleblowers meet this fate in China. But at a time when the whole world's attention is on China, when everyone is talking about this cover-up, this case is just too brazen. In the global spotlight, China is trying to wipe the facts. But the people of China are trying to keep the truth alive. Chinese citizens have become watchdogs. It's a very brave act. They have found unique ways to bypass censors and share the real story of the Wuhan virus outbreak.
This is not the opening sequence of a Star Wars film. This text in Mandarin is an interview with Dr. Ai Fen, something that Chinese censors are trying to erase. Ai Fen was one of the first doctors in Wuhan to discover the new coronavirus. She serves as the director of the emergency department at the Wuhan Central Hospital. A state-run magazine had spoken to her about the outbreak in March. The interview has now been deleted because it exposed how the Communist Party tried to hide the Wuhan virus. But in a valiant effort, netizens in China have rallied to keep the story alive. They saved a copy of the interview, and now they are coming up with various ways to preserve and spread it. One user produced the entire text backwards. Another one recreated it using emoticons. A creative mind inserted it into the famous opening of Star Wars. You would ask, why are Chinese netizens doing this? They are trying to protect this interview from the Chinese censors. China has been clamping down on dissent. Any criticism of the Communist Party has been wiped from the Chinese internet. So Chinese internet users came up with elaborate but effective ways to save an interview. The definitive evidence of how the initial days of the outbreak played out. An English translation of Ai Fen's interview was published on the Chinese internet. It describes how Ai Fen was reprimanded for speaking out.
This tragedy could have been avoided. On December 30th, 2019, Ai Fen received a test report of patients with the unknown pneumonia. She circled the word SARS coronavirus in red. When asked by a former medical school classmate, she took the report and shared it with her, a friend who is also a doctor. That night, the report spread within the doctor circles in Wuhan, and those who forwarded the report included 8 doctors who were disciplined by the police. This led to trouble for Ai Fen, as she was the source of the report. She was interviewed by the hospital disciplinary committee and suffered unprecedented and severe rebuke. They said she was spreading rumors as a professional.
The report shared by Ai Fen became the first piece of evidence of the outbreak. The same report was also shared by Dr. Li Wenliang, another whistleblower who was harassed by the Chinese. Dr. Li later contracted the coronavirus himself. His death in February had triggered public outrage in China. Dr. Ai Fen and Dr. Li Wenliang were the first to speak out. They were muzzled and punished. China tried to do everything to hide their accounts of the outbreak. But determined Chinese netizens are keeping their stories alive. In fact, they are spreading them beyond China's borders. A post on Twitter shows how Dr. Ai Fen's interview was recreated in Braille in the form of a QR code. And even telegram codes. China's powerful censors are failing to hide the truth about the Wuhan virus. Bureau Report, WION, World is One.